March 10, 2020 marks the onset of the COVID-19 pandemic in Jamaica. It also marks the day Jamaica's health system proved its resilience. Healthcare workers had to re-strategize in order to arm the nation with the requisite knowledge to fight the COVID-19 monster. The Health Promotion and Education team of the Western Regional Health Authority joined in the fight, not only fulfilling their mandate, but also touching the hearts and lives of the people of Trelawney, St. James, Hanover, and Westmoreland. Health-focused strategies were utilized during this period to plan, implement, and evaluate COVID-19 prevention measures.
2020 has been a journey for the Western Regional Health Authority, Health Promotion, and Education team. It has been one that from the pre-preparation stage, we have been integral into the planning, implementation, and evaluation of the various strategies used to fight the COVID-19 pandemic. From very early, we started looking at what were some of the things persons were saying about COVID-19. As Health Promotion and Education Officer, it is critical that we are guided by an evidence-based approach in doing our interventions. And as such, we started collecting data, one, to keep our fingers on the pulse of what was happening in terms of COVID-19. We also collected data to guide the planning program both at the national and the regional and parish level. As such, very early we started finding out from our healthcare workers what were some of the issues as it relates to their psychosocial needs. So our first survey, we looked at the psychosocial needs of nursing personnel within the Western region. So the survey showed a relatively high level of knowledge about COVID-19 among nurses. Most nurses preferred to obtain COVID-19 information via our local television, and that was 85%, while 77.9% shared that they prefer to get information via the government website. Among the nurses surveyed, 61% of these nurses stated that they were fearful but optimistic about the COVID-19 pandemic, while 14.5% expressed a feeling of fear. And so this from very early give us an idea what it is, what are the interventions that we should be conducting among the nursing personnel.
From the findings, the COVID-19 Vaccine Ambassador Program was developed to target healthcare workers.
I've had the opportunity to participate in a lot of the pre-vaccination training programs within the Ministry of Health. In the Ambassador Program, my main function was to communicate on an ongoing basis and answer questions, to communicate updates from the Ministry of Health, dispel many of the myths that have occurred, and to encourage and support our teams to take the opportunity to take the vaccine where they, as long as they understand what is happening and they recognize the importance of taking the vaccine.
We also looked at some of the things that were happening on the ground. So among residents, this gave us an idea what was happening on the ground and how to pitch our communication campaign.
So having garnered the relevant data at the local level through various surveys, the Health Promotion and Education teams donned their broad hats and boots and headed to the field to tackle COVID-19.
With the onset of COVID-19 and the need for increased sampling, the St. James Public Health Services took the decision to go out on the streets to be able to bring the services to persons who were, first of all, reluctant, and some persons who were maybe too busy to come in and get sampled. So we targeted the town center at one point. We ensured that the service was available like every Monday in the town center, so persons after a while would realize that on a Monday the St. James Public Health Services is in the Samtrop Square area and we're offering free COVID-19 sampling. We also took to the rural areas where persons were reluctant and hesitant in taking up on the sampling. We met with a whole heap of resistance there, but there were some persons who were tested, were sampled, and after a while it becomes like natural for them to anticipate us going in. It was a rigorous journey. Persons were always having a lot of stuff to say in terms of what they think about COVID. We could not have done this by ourselves, so we had to partner with churches, we had to partner with community leaders, members of parliament, councillors, and so in that sense we were able to reach even into the workplaces.
Over in Westmoreland, the health team targeted taxi drivers as their focus group within the parish.
The intervention with the taxi operators with regards to the COVID-19 protocols, I should have said. About 8 months ago, we had seen some data being produced by the Ministry of Health that persons who are in conveyance with COVID-19 are 2 or 3 times more likely to be infected than someone within a household. So it was out of that we had decided to embark on this initiative since the taximen would have been in that group. And so we conducted a survey to ascertain if they were adhering to the protocols, wearing the mask and sanitizing of the hands. And we know social distancing is not possible in the taxis, but we know they could wear the mask, which will help to reduce the likelihood of persons who might be inside the taxis with COVID and transmitting it to other persons. And so we embarked on this initiative. We targeted taxis within the White House area, in the Negril area, Grange Hill and Sav. So we had Dals and Betheltown too. We collected the data and then analyzed it, and we use that now to inform our strategies in relating to the taximen. So we did sensitization session with them, reminding them of the importance of the mask wearing and to encourage their passengers to wear the mask. The key findings from it realized that they knew of the risk of getting COVID-19. They know about it. When we asked them, they know that they're at risk. But some of them would have said that they had issues with persons who were reluctant in wearing the mask. But they knew of the risk, most of them. And the issue of mask wearing, they said some of the passengers were not willing to wear the mask, but they are always insisting that the passengers who come into their taxis wear the mask. This was evidence-based, so we basically use evidence to plan the strategy. So the data came out of the Ministry of Health, and we use the data now to plan the strategy and to target the taximen in minimizing the risk of persons getting COVID-19 in the event that someone in the taxi or in the taxis are infected with the virus.
The interventions were well received by the target group, who testified of its effectiveness.
This work out very nice for the passenger when they come and see it and put on their mask. Without it, they don't come in the car, they can't come inside in the car. They have to, because this is the sign, show them.
The badge thing is work good. Because without the mask, no one can enter. And it's very good for us too. Yeah, and I have my sanitizer. Yeah, it's working good.
Meanwhile, Trelawney and Hanover employed a different approach based on the landscape of the communities they work in.
We have employed a number of interventions for a team. Some of the major ones are mobilization, getting the community to know what is happening or what we're about to do, get their buy-in. all right? And there's a networking with key stakeholders as those key community persons and business persons within the community. Our first intervention was that one in Bottomtown, Trelawney, and that was in Clarkstown. What happened was that it was believed that there was someone of interest who came from the United States or overseas, went into Bottomtown and maybe, believed to have had COVID-19 and was socializing with other persons there. Now the community would have alerted the health department. And of course, Dr. Diane Dale, who is the medical officer of Trelawney, and of course spearheaded the whole thing. She was very instrumental, got the team together, we met and then would have informed the community. Now, we would have been doing groundwork in the community because we would have had other activities in that community. Bottomtown is a go-to community. They are always on board, they are very supportive and very cooperative. Persons within the community would have assisted us in mobilizing and getting persons out to come and do their COVID-19 test. It was really a very good intervention. I think we did close to 100 COVID-19 tests on that day. The community activity is very important because sometimes you find that we don't get the persons to the health facility as we'd have wanted. So going to the community where you can really interact with them, get their involvement, have them being a part, being there where they are in the community, you find that approaches like those, are way better than bringing them out of the community. Since we have the cooperation and the support of the community, and I would have been emphasizing this from the beginning, we would have done an ambassador's training in recent time for a number of persons in various communities. So that is one of the next things that we'll be doing for Bottomtown, as well as going in for vaccination and having some vaccination ambassadors. And no doubt, the community will be on board.
Over in Hanover, multimedia was used to reach the residents of the parish. This saw the creation of Hanover Health TV.
Intervention which is called Hanover Health TV, and this is a network of televisions that are in the public health facilities throughout the parish. So in primary care, which are the health centers, we have 8 smart televisions, while in secondary care, which is the hospital setting, we have 4 smart televisions currently. Even before the COVID-19 pandemic, we had been using the televisions to show health videos, right? And we even used some health videos that were produced by Jamaica Information Service, as well as other television production that were done by the Ministry of Health and Wellness. And we realized that the clients of the health facilities, they tend to gravitate towards watching the screen. So it was very effective based on our view from the Parish Health Promotion and Education Unit. It was that much effective that we decided that we want to have a local program on the television. And that's where our local program was born, which is called Glance for Better Health. And this is every month we try to produce a new video at the local level using persons within the health facilities. So we target different health professionals, different disciplines to bring across messages for the clients that we serve.
For the Glance for Better Health television program, we have seen some behavioral changes in terms of, one, from persons who are presenting, because what you find is that it allows them to express more on their particular health topic, and also we try to make it to the lower level that each person can understand. And you also find that for the clients, when they see persons that they know, they more tend to identify, they pay attention. And we're hoping, though it's not where we want to be, as it is a fairly new program, we're hoping as time progresses that we will be able to impact for these persons to make healthier choices. Success for us is being able to produce to date. Currently we have 5 episodes of the Glance for Better Health program. These episodes are viewed on the smart televisions in the different facilities. In the future is that we can have a segment where instead of pre-recording these messages, we can have them that we can go live, and that we will be able to establish a YouTube platform as well that we can upload these videos to for a wider population to view them.
The work of the health team is usually made harder without support from stakeholders and partners. For this reason, the Health Promotion and Education team at the Western Regional Health Authority is thankful for the partners that came on board to support the activities of the region. For the stakeholders, though, the partnership was a no-brainer.
As it relates to the health promotion team and how the interaction with the other departments within the health sector and the COVID-19 and managing the COVID-19 pandemic, we find that they are a very integral team as to how we will have our activities being carried out. So our activities are, as you will note, we're at primary care, so our activities are community related. And as it is for the community relations, we'll have our health promotion officers engaging the community members in order to educate about the COVID-19 virus, educating them about the COVID-19 vaccine, the importance and dispelling some of the myths that surrounding the messages out there about the vaccine, and help to promote the vaccine for all of us to get back to the life pre-COVID. So we find that they are very vital to our organization.
As the fight with COVID-19 persists and the team continues to fulfill its mandate, they look towards success with bated breath. So let us all join together as we fight to overcome the COVID-19 pandemic.